Hello, everybody, and welcome to the show. I could not be happier to bring you somebody who I highly regard. His name is Dr. Richard Schulman. You will get to hear his wonderful voice and see his fabulous face in just a moment. I want to make sure that I set up this talk, this video, this podcast for you the way it truly went down in a true Sharon Feckety transparency way. I met Dr. Schulman through another friend. And if I wasn't working with a client, a physician client in Sarasota, I would have never been led to him. And then if I was never led to him, I would have never been led to Dr. Mark Sylvester. And, and it goes on and on and on. And I really feel strongly about when you're paying attention and listening to the whispers, you will be led. You will be led to all of the right people that can really just ignite something and help so many people. And I know that Dr. Schulman and I, we relate a lot to the same feelings of there are no coincidences, only some maybe haphazard divine interventions. So Dr. Richard Schulman is here to talk to us today about trauma. Welcome to the show.
Hi, Sharon. Good to see you.
It's always good to see you. Zoom is an incredible thing. At least I get to see you. I don't have to drive 40 minutes anymore.
Well, it probably is an hour by now, but what the heck?
So Dr. Schulman fascinated me for so many reasons, mostly because he had all these guitars in his office, which I loved.
I got more at home, if you look behind me there. I don't know if you can see
them. Oh, we see them. It's all about music for this wonderful psychologist and human and artist and many more things. But we connected certainly on a music level. Music has always been a great pleasure for me and pleasure for him. And beyond that, there were just a wonderful sense of connections, I feel like, between us. So I'm so happy that you're willing to help the audience today, because that's what this July month will be all about, just mental health. And I don't think that we talk enough about trauma. So Dr. Schulman, take it away. Please let the audience know who you are, what you do, and whatever it is that you want to say about trauma. It's all you.
Wow. Okay. Well, I'm a licensed clinical psychologist, and I've been around for a while. I first got licensed in 1987. I got my doctorate at the University of South Florida in clinical psychology and did a psychology internship at the Palo Alto VA Medical Center, which is technically through Stanford Medical School. I guess they blinked and I got in. I had some amazing teachers throughout my career. I'm very blessed with brilliant and wonderful teachers and experiences. I worked on the Family Studies Unit at the Palo Alto VA. That's kind of where the birthplace of family therapy was. I worked as an eating disorders program coordinator at USF. That was my first job. I worked on an adult psychiatric unit, an adolescent psychiatric unit. I did chronic pain management, work with alcohol and drugs. And, it's funny because you mentioned guitars. Music is so important to me because it's all about vibration. And my body can't tolerate alcohol and drugs, so music has become my drug. And I really use it every day to smooth me out, because you see, we talk about trauma, we talk about a very low vibration. If you look at a spectrum of things, trauma, fear, rage is going to be a low vibration, but love, peacefulness is a high vibration. And we get stuck in this low vibration in our culture. And if you take the response to the pandemic, it's all low vibration. It's all about fear. You notice every time you leave somebody's office now, they'll say, stay safe. Why would you have to remind me?
Yeah.
So we're living in a soup of trauma right now. And because, because it's everywhere, it's a unique experience for me as a psychologist and psychotherapist. I was used to dealing with trauma. When I was a grad student, one of my first jobs was on an eating disorders clinic. I later graduated and got a job with that psychiatrist. And I went to the psychiatrist after working there for a few months, and I said to her, "Do you realize all your patients have been molested?" And she looked at me as if I had three heads. She says, "That's not in the literature. How do you know?" I said, "Well, I asked them." And it was a few years later, I wound up presenting a paper at a big eating disorders conference about assessing sexual trauma in eating disorders patients. Well, think about it. Anything strong enough to disturb your eating, you got to eat to live. You know, you don't have to drink alcohol to live, but you have to eat. Anything that would disrupt eating has got to be pretty powerful. And you reminded me of one of my sort of psychiatric heroes, Gabor Mate, who said that addiction is a response to human suffering. That translates to me into trauma. And you know, the diagnostic manual talks about post-traumatic stress disorder. I don't think it goes far enough. They talk about trauma as sort of a life-threatening situation that you either experience or you witness. Well, how about a kid that goes through his parents' divorce? Is that a trauma? I would say yes.
I would say yes.
How about the kids that couldn't go to school this year and they're seeing people walking around in masks? You think that's not traumatizing to these kids? It's very traumatizing. So I would amend what the diagnostic manual has to include anything that alters the way you live as traumatic. And I see it everywhere. And I've had to sort of recalibrate where I go with this, because the levels of trauma, the levels of pain, the fear, the rage, it's as if the COVID-19 experience has amplified everything. So people come into my office, they don't always talk about, well, I'm scared I'm going to get sick. But everything I'm hearing now is at a higher level, as if the energy of the society is ramping up all the wounds that people have. And I have a patient who said to me a couple of weeks ago, "I'm getting out of town. I'm going with my sister. We're going out of town. I can't take this anymore." I said, "Where are you going? Alpha Centauri?"
Right.
Where are you going to escape this?
Yeah.
I mean, every year, usually, not so far, I go to California for a week and visit my friends in the San Francisco area. It's always a great reset for my head. I can't go there this year. What's the point? What's the point? There's no reset. So when you're dealing with trauma, you're dealing with activation. Okay, so it's 4th of July today. So let's say that in your family, there's a vet from,
it's actually 4th of July today. It's Monday.
Sorry.
Recording it on 4th
I'm
of
sorry.
July.
I forgot.
No.
I forgot.
So happy 4th of July.
It was 4th of July when we recorded this. Anyway.
Dr. Schulman, how many articles do you think are in the paper the day after 4th of July? Let's make a prediction right here, and then we'll have it on tape. How many people blew off a finger or a hand? Not that that's what we want, but that's what always happens.
Well, that would certainly be traumatic. I don't even like reading about it.
I know.
Anyway, so let's say that you know, I know a lot of Vietnam vets, and I've treated some Iraq and Afghanistan vets. So now here we are. It was the 4th of July, I guess, if we're going to keep the timeline right, and the fireworks go off. These guys are back in the jungle or the desert.
Yeah.
And in fact, one of my you know, I think of some of the patients as my greatest teachers, and I had a patient who was a true multiple personality years ago, and she had been horribly mistreated by a cult, and she was in a flashback, and I said, "Do you know who I am?" And she said, "I only see your eyes. I see, you know, all the people who are, you know, going to hurt me all around you." Well, she tried to go out the window. I was on the third floor office then, and it was the best tackle I ever made. I'm not kidding. I tackled her, managed to, we still had phones that weren't iPhones then, and I managed to pop out 911. And this is the crazy part. The officer showed up, and real nice guy, by the way, big guy, about 6'3", Officer Robert Law. Can you imagine that? Showed up in the middle of this insanity. When she saw him, she went nuts. And she became so strong. He was a real big, strong guy, and I wasn't weak either. Took both of us to keep her from going out the window. She had been activated. And the activation made her, it was almost like a time machine. She really believed that she was in with the cult that had harmed her.
Yeah.
And there was, and you really could not get her out of it.
Mm-hmm.
You know, we had to get her to the hospital. That's a pretty extreme case. I deal with a patient right now who gets activated by certain triggers. He had a lot of abandonment things. So when his wife looks at him funny, he will go off. Well, he was also a vet who had been in combat. And we've learned what he has to do. If there's a learning process, this guy needs to chill. So she'll call me up, he's activated. I said, okay, is he physically or threatening? Is he yelling? She says, no. I said, let him chill, let him come to you. So we try to develop this with whatever the situation is, but some of them are very, very extreme. And right now, I have this wonderful body therapist that I'm working with, and I'm so excited because I haven't had one in a while. And we are going deep into the trauma, into where it lives in the body, how it lives both in the gut, the limbic system, because we're looking at a true mind-body therapy. I'm not going to be able to talk people out of that trauma. Most of the time, the trauma is in the body. Any kind of physical trauma, sexual trauma is going to be in the body. And there are three kinds really of trauma. And this, once again, is not in the diagnostic manual. One is a catastrophe. You're in a plane crash. Okay, that's a trauma. You may have nightmares, flashbacks. You may have physiological responses to things that remind you of that crash. All you need is one. Then there's something that's very severe but repeats. So let's say you're in a soldier and you're in a battle, and then in 5 days you're in another battle, and then in 3 days you're in another battle. So that is additive. But there's a kind that nobody talks about. That's mild to moderate wounding that happens every day. So you take a kid who's in an alcoholic family, let's say, and dad comes home drunk, and he may not be physically abusive, but he's mean and everybody's walking on eggshells. It happens every day. That turns into a major league trauma over time, because the whole thing is additive. I'll go back one step to the vet who's watching the fireworks. That experience of watching the fireworks and going into a flashback is a new trauma.
So I want to ask you a question. What about generational trauma?
Tell me what you mean by that. You mean genetic transmission?
No, I mean, say a woman is pregnant with a child and they are fighting with their husband. Is their trauma transferred from generation to generation? Watching the wounds of, I mean, this is just, I'm listening to all of this, okay? So I want to make sure that I come clean about what's happening with me, because a lot of what I asked, when I ask somebody to interview, it's because I am very curious myself, okay? So
I would hope so.
Yeah, it's no secret. I am sober 25 years and I suffered deeply from depression. And it wasn't until after I released the book that I started identifying so much with the trauma that I had been through, which was the cause of much of my addiction. So the trauma, which you just mentioned, of this kind of like minuscule even it could be major to somebody, right?
Yeah, let's not call it minuscule, but
Okay,
we
so
could call
let
it
me
mod.
right. So me not being a professional, I say minuscule. I'm sure there's proper terms
That's
for it.
probably how you survived, by calling it minuscule.
Yeah, because to me, whatever it was that I might have been going through, which I really think that my childhood trauma was mostly about having acne, being overweight, not feeling like I fit in, because that's why I drank. I drank so I could feel better. I drank so I could fit in. I drank so I could forget about my acne. I drank so I could forget about being chubby. I drank because the boys didn't want me, whatever it was. And then, now learning and releasing that book about mental health and what I went through in my own story, I read this book, Lost Connections by Johann Hari. Have you read it?
No, I have not.
You would love it. Just as a friend, let's pretend we're not even on the show.
I already am.
So, and then I'm just listening to, how so much of what brings us to all of these other addictions, whether it's food, like you talked about, or whatever it is, it could be something that, maybe isn't that the Vietnam War, or it isn't, a crash that we were in. It could just be our own personal trauma, right? I guess that's where I'm going with that. I wanted to make sure that the audience understood, because it was very revealing to me, who's somebody who's been working on themselves for 25 years, that, I did make it minuscule, like you pointed out. Well, I mean,
Well, to answer your question, of course it is. The thing that people really don't understand about trauma is that people who have post-traumatic stress disorder, I don't even like the term disorder, because it's actually an elegant, sophisticated way of dealing with high stress. People who have this are the strong ones, because they don't fold during the stress. They fold when it's safe. People will tell me time and time again, well, why is it now that everything's okay that I'm freaking out? Well, you had to get through whatever was happening. So you pushed it down, you got through it, you did what you needed to do. Now you're safe, you can let it go. And I think it's one of the hardest things for people to understand. They assume that people with post-traumatic stress are the weak ones. And it is so 100% wrong. They are the strong ones, because they didn't fold. They kept functioning. They kept taking care of their families or their jobs, or if they were soldiers, the people in their group. So it's one of the most important things for the average person to know, is that our psyche will protect us during these events that are called trauma. Yes, you mentioned earlier, does trauma happen to you, or does it happen inside of you? Well, yes, to both. Certainly your perception of it will color how you deal with it. Of course, there is something about getting hit by a wrench that is from the outside. In any event, the psyche will protect us. So how does it do it? Okay, I was in a car wreck years ago, and it was a Sarasota special. I got hit from behind at a red light. That's what the police officer said. Well, the guy must have kind of realized he was about to hit me, because I heard a slight screech. And then I went into what apparently was a very high trance, because time was distorted. I saw the world in snapshots. What probably took about half a second seemed to me to be about 20 seconds as I was being hurled toward the windshield. Fortunately, the seatbelt grabbed me before I hit it, and that's what put me back in real time. So the psyche will protect us, but we pay a price. We pay a price later.
Like? Can you explain what that looks like?
Oh, well, I can tell you, for me, I was puzzled, because it was kind of like there was a windshield here. I kept going, why is the windshield getting so close to my, and then the seatbelt grabbed me and it pulled me back into real time. Now, that isn't true for every person who experiences a trauma. But people, when you ask people, well, how are you seeing this? Are you seeing it from inside of yourself, or are you watching a movie you're in? Well, if they're watching a movie they're in, they've left their body. So we see a lot of that. And in the past week, as I said, I started working with this body therapist, Samantha Haynes, and she's really terrific. The level of trauma that people are reporting, and I don't know if it's just because now they're awake to it because of what's going on, but it is deeper. And I've been doing this for a long, long time. It's deeper than I've ever seen. The kind of things that are coming up are so powerful.
Well, don't you think a piece of it, of the reason that some people are coming forward in such masses, is because we've never had this global opportunity to sit with whatever it has been that has affected us?
Yeah, I hadn't thought of it that way. Yeah, it's real possible, but I think to me, it's more something like this. Okay, if I have a picture in here and you don't like it, you don't have to look at it. We can have a nice conversation. If I got music on that you don't like, as long as I don't put it on too loud, we can have a nice conversation. Now imagine my dog took a poo in the corner and I didn't clean it up and it stinks. Kind of hard to have that nice conversation because it stinks, it smells. The stress in the air right now is like the dog poo that wasn't cleaned up. You smell it, you taste it, you feel it. Everybody is looking at each other funny. Now there's no doubt that when people sit with things, it's more likely to bubble up. You're absolutely
right. Rise? Is that what you're saying?
Excuse me, say that again?
So the shit rises.
Well, something like that, yeah. In
you
fact,
say poo, I say
remember, you remember Primal Scream? Remember that old treatment? Oh God, John Lennon was there. Anyway, what they would do is they would isolate a person for days at a time with just a pad and a pen. And wait until they started going, releasing whatever was going on. And I think, it was an interesting idea. I think it's a bit much. I think, you can just say hello and get some of the same effects.
Well, I think what I would like to, because we're coming down to the wire, and I want to make sure to give our audience as much value as possible. And if there's anybody that can offer value, it's you. What you were saying before about all of these people coming to you, and there's so much trauma right now. I mean, I know that your office is busier than ever. Dr. Sylvester's, I'd love to speak to your body therapist. I think anybody that is working within the trauma space is a value add to an audience that might be looking for help. If a person does not deal with trauma, whatever that might be, grief, the loss of a loved one, losing many, not having a job, losing a job, going through a divorce. Can you speak about what happens? What happens? That's why I asked before, like, what does that look like? I know for me what it's like. I know that it looked like addiction, drugs, alcohol, whatever I could do to escape how I was feeling. And had I dealt with what was going on, or had I been able to put a voice to it, I didn't have that. I had love in my life. I had people that loved me, my parents, and I know that so many parents take it so personally when their children or somebody doesn't come to them. I want to just hear, what people can do, when they feel, when they're going through that, like showing up to work no matter what, I just lost my daughter, or, I just watched this horrific car accident, or I was in one, and we just keep going. What does it look like, and what can we do to help them through that?
Well, first of all, what I see are people who have panic attacks. There'll be major depressions, rage attacks, psychophysiological kind of stuff, stomach aches, headaches, pain that seems that medical doctors can't explain, relationship problems, of course, addiction. Now, the problem here is that trauma is encoded differently than ordinary memory. So like I said, in the car wreck, I was in kind of a hypnotic trance. There's a law in psychology called state-dependent learning. The state you're in when you learn something determines how you retrieve the information. Study for a test, drink a lot of coffee. Drink some coffee when you take the test. You'll remember it better. So we have to work with some kind of trance phenomenon. when we're dealing with trauma. I found in the VA, I couldn't talk the guys out of their trauma. In fact, they got worse because the trauma came up and there was no exit point. Okay. That's why I developed the body therapy work. Was the idea was creating exit points. But you know, if somebody touches you with a healing hand, you're going to relax. You're going to start to go into that state where the memory lives. So there is great value, I think, in talking to someone for most people, okay? It doesn't always go far enough. I think you start there. You start by talking to a counselor or a therapist, but make sure they know something about trauma. A lot of, you know, what I'm finding is, and I think this is actually healthy, people come to me after going to 4 or 5 other therapists, some of which say, this is over my head. And I think that's a very healthy thing that they would say, this is over my head. Because if you're not trained in this, you can make bad mistakes, and I believe you can hurt people. You know, take a surgeon's knife and give it to a mugger. You know, I mean, come on. You have to be trained in trauma. You have to really kind of know what you're doing. You have to put people back together at the end of the session so they can function. And you have to be aware. One of the things I say to patients is, okay, you probably do pretty well to the next session. If anxiety or rage or something bubbles up, it just means you started the next session without me. So I like to be involved in my sessions. Please call me at that if that comes up. Not everybody will have these severe kinds of reactions, but what people may have is a general numbing of emotion, an inability to connect with people they love. You know, one of the criteria, one of the things that I noticed with people who have post-traumatic stress disorder, they don't think they're going to have the relationships that they want, the career that they want. They don't think life is going to turn out well for them. And I think that it becomes a self-fulfilling prophecy. One of the things that after I went through, you know, the time in my life was sort of an ego death, I realized that I thought very negatively. And that when I started thinking positively, a simple thing like, you know, like they say, fake it till you make it. Make yourself think positively. It has amazing results, but you won't do it if you haven't processed your trauma.
Yeah. So I love that you had started this episode talking about the vibrations of love. And I do believe that a lot of, from my own personal experience, I had the great benefit of having a fantastic psychologist, a fantastic psychiatrist, and I also had community in the fellowship that I belonged to. And of course, I had the love of my family. And all of that was the reason that I was able to go through, even though I still believe I did not deal with my trauma entirely, I have been able to work a lot of it out because of working on myself and speaking about it and trusting and all of that good stuff. And, you know, there's more work to be done, right? I am a work in progress every day. But I really do believe that that sense of love and community is so important. And I love that you spoke about that first, because sometimes, you know, that's the greatest answer, is just to know that we're not alone.
Well, I really believe that, you know, it does come down to compassion, but compassion has 3 elements, and people always forget the third one. The first one, of course, is kindness. And, you know, that's what you described from your family and friends and the fellowship. The next one is empathy, okay? Accurately being able to identify how you feel. The third one is action. No action, no compassion. The rest is just sort of wringing of hands, you know. We got to have action, and that's either going to somebody who knows what they're doing, and there are many kinds of action-oriented therapies that you can do, you know, and it does involve this vibration. We're resonating with the low vibration of the trauma and bringing it out, raising the vibration, but you got to resonate with it first, you know. And I think that's what, when I work with the body therapists, I think that's what we're doing more than anything else. We're getting in there, resonating with wherever that is, and it usually lives somewhere in the body. Either the person is unable to speak their truth, it's in their gut, they're angry, their heart is blocked, there's all kinds of ways of looking at it. But in the end, we raise the vibration, and we want to have it as a loving vibration. And there's something about recounting your trauma in a safe place with people who care about you and are non-judgmental, and maybe even give you another way to think about it once you've had your emotion. Because in the end, you know, like you said, it does happen within you as well as to you. So you've got to process the within you. How do you think about it? Why are you holding on to it? You know, what are the factors that would keep you lying to yourself about your beauty and your nature as a child of God? I mean, you know, in the end, we're all children of God, and the idea that somehow we're no good, that's ridiculous. But we don't know that.
Right.
And you have to have that experience as you're going through your trauma, that you still can receive unconditional love, that you still, you know, can express yourself. So, you know, it's an amazing thing to do for a living. I mean, you know, it's very hard. I take on a lot of the stuff. I have to clear myself every day. That's why I have a whole bunch of these around.
You're saying guitars for anybody that's listening. You didn't get to see him.
Oh yeah, well, it's right. But I have to clear myself every day because I absorb it.
Yes.
And it's an occupational hazard. It's sort of like a secondary post-traumatic stress. There is a couple of things I would say. People going through the therapy will experience a form of post-traumatic stress because it's stressful to even have the therapy. People who have the symptoms will be seen as trauma too. So for the therapists out there, you've got to consider all these things. You can't just say, okay, well, you know, you talked about the war, so see ya. It isn't that simple.
Yeah, and that's why everybody will have an opportunity to listen and watch you and Dr. Mark Sylvester on your alt psych show. You have a podcast and it's on YouTube. And I highly recommend, because you did a show about like healers healing each other, because you do. Listen, this morning, Monday, bunny ear, I lead a recovery to mental wellness group, just people coming together as a community. And right after that, I go to a Zoom spiritual meeting in New York with my people, with our people.
You go back to New York?
I went to New York
I can't believe you go to New York.
I went right on my Zoom.
You get a pastrami sandwich and bring it back.
But I would have, if I could have gone to the deli on my way to going to New York, I would have. But I had to cry through that because I was taking on everybody else's pain because of being an empath and caring for others and being able to feel that. And now I will go ride my bike in nature. You know, I will heal myself like you heal yourself. I will listen to good music. You know, it's a lot of work. It's a lot of work, people. So I'm going to just say thank you. Thank you for doing the work that you do. In the show notes, we're going to have all the information of how to get in touch with you and how to get in touch with the wonderful work that you're doing. And I hope to have you back real soon. Thank
Absolutely,
you.
Sharon. It's always a joy talking to you, and thank you for inviting me.
Thank you.
Okay, everybody be well out there.
Be well. Stay safe.
No. We know that already.
I'm messing with you. Bye. So don't forget, if you mention that you have seen the show or listened to the podcast, Thai Technology, 3 months for free.